Thank you all for joining us today on your lunch break on this awfully rainy day. As Hannah said, I'm Diane Delano, and I am a policy analyst here at Advocates for Children of New Jersey. And I've been with the agency for about 10 years. And as Hannah indicated, prior to that, I worked for Prevent Child Abuse New Jersey and was part of the team that brought home visiting here to New Jersey back in the 1990s. So I have been able to watch the home visiting system grow and expand throughout the state to the system that it is today, which we're very proud of. We're one of the national models for home visiting across the country. And we're very excited about the journey we've taken. So I'd like to share with all of you where we're at today and where we'd like to be moving in the future and what your role would be in really helping us to get there. So Hannah, if you could pull up the slides. Let me see. So as part of the background, and I'm sorry if some of you have heard this story before, but there's always a lot of new information to learn, and we're in a very different place than we were last year in terms of our work with home visiting. So first of all, I'm not sure how many of you know about our Unlocking Potential plan. Back in 2020, we received a grant from the Pritzker's Children Initiative to develop a plan for how we wanted to see New Jersey address infant and toddler issues. So our plan was called Unlocking Potential. And what it really was is a roadmap for making New Jersey the safest, healthiest, and most supportive place to give birth and raise a family. And what we wanted to do with this plan is really look at what areas do we need to work on. It's not just for this age group, there's so many different ways that we could support infants and toddlers and their families. And families are key to it. It's not just dealing with the infant and toddler. At these early ages, you can't do one without the other. So it has to be something that engages families as well as the babies. So our plan really articulated a strategy to unlock the potential of every New Jersey child so that they grow up healthy, safe, and educated. And we're also trying to unlock the potential of every parent, guardian, educator, service provider to be the best that they could be in their role of working with infants and toddlers. Next slide. So as part of the plan, we had four main objectives. One had to do with expanding access to high quality childcare. Another had to do with expanding access to infant mental health services. We also wanted to expand access to maternal and infant health services starting prenatally. And the final goal was really to look at home visiting. And our goal was that we would reach almost 10,000 more families of infants and toddlers from low-income households to enable them to access home visiting services. At the present time, when we first started this work, we were really only serving about 3% of the population that could benefit from these types of services. So our goals were to increase the service capacity and program completion rates within the current system of evidence-based home visiting. We wanted to expand the capacity of the current evidence-based programs to be able to reach some additional families with home visiting supports. And we also thought that it would be important to reframe and develop home visiting as inclusive of all families who want to participate. It's our opinion, and I think the opinion of many, that all parents need support and information at or around the time of birth. It's something that's stressful for everybody. It's something that's new and different, no matter how many children you have. And Laura, you can attest to that. Each one is unique. Each one is different. And, each birth brings new surprises and challenges. So we feel like it's important that everybody has access to some type of support around the time of birth. And by just restricting it to a very small percentage of the population isn't of value. So we wanted to really see our system grow and expand. Next slide. So our goals for home visiting in New Jersey, and this goes across all of the different program models that I'm going to be explaining to you in a little bit. But our overall arching goals were to reduce disparities in maternal, infant, and early childhood health outcomes, to increase positive parenting, to prevent child abuse and neglect, to improve family economic self-sufficiency, and to promote early childhood development and school readiness. We know that all families aren't the same, that everybody's going to have a different need. And these programs are very flexible in that they are the perfect way that the services could be designed to meet the needs of that family. So for some, it might be that they need help with the parenting aspect. For others, it might be family's economic self-sufficiency. And for some, it might be health. For some, it might be all of it. So we want to make sure that the services are designed to meet the needs of the families that we're serving, not vice versa. Next slide. So right now, we're really proud to say that we have programs operating in 65 communities across the state. Every single county has 3 evidence-based models available to families. And these models are evidence-based, meaning that research, extensive research has gone into demonstrating that these programs are effective and are really doing exactly what we had hoped that they were doing in supporting families in a wide variety of ways. The models are national models, some international models, and have been in existence for years. Here in New Jersey, we've had most of these programs for over 25 years. So we've been doing this work a really long time. The program models are Healthy Families New Jersey, the Nurse Family Partnership Program, and the Parents as Teachers Program. And as of July of 2021, our state signed into law that there will be a new universal home visiting program, which right now is in its infancy, its planning stages. But we're happy to welcome this new baby to our mix and are looking forward to being able to roll this out so that it's available to all parents who want support at or around the time of welcoming a new baby into their home. Next slide. Okay, so as I mentioned, each program model, they have very similar characteristics, yet they differ in a little different ways. And I just wanted to run down how these programs operate. So with Healthy Families New Jersey, families are visited with a family support worker, and families could be linked with these services during pregnancy or within the first few weeks after the birth of a child. The program can serve families up to age 3, and if necessary, they can also go up to age 5. And what the family support workers are trained paraprofessionals. Generally, they come from the community that the families live in. So they're very familiar with the needs and concerns of families within their own neighborhoods, within their own communities, and can really help to provide them with the support and linkages that they need so that they're ensuring that they personally, have access to services as well as their child. And again, it's all based on what the family presents as what their needs are. The NFP program, the Nurse Family Partnership Program, is a little different. Whereas they utilize registered nurses. So their focus may be more of a healthcare focus first, but they also address other issues and needs of the families. But the person that comes to do the visits is a registered nurse. And they're pretty strict with who they are able to provide services to. So they really work predominantly with first-time pregnant women, and they like to make sure that families are enrolled in these services prior to giving birth so that that family is supported from 29 weeks on, and is brought on before the child is born, and then continues to be a support up until the baby is about 2 years old. And the nurse can provide healthcare information for both the mother as well as the child. And it's really important that the moms get access to healthcare services. And this is critical in reducing maternal morbidity and mortality rates. We know that moms generally don't go to their first postpartum postpartum visit until 6 weeks after having the baby. And so much can happen in between those times. So having a nurse there to check in on the mom, as well as the child's healthcare needs, has found to be very beneficial for the families, and has really helped to link families that might have had moms who might have had some healthcare issues and needed to be seen by a healthcare professional prior to the general 6 weeks, that really provide life-saving supports. So the other model is a parents as teachers model, and that one's more of an educational model. They're certified parent educators, and they also can work with a family anytime during pregnancy, but they're the model that will take a child that might be a little older. So if the child's 6 months or a year, there still is a way to engage them in these services. The goal really is to get a family as early as possible in their pregnancy and or right after the baby is born. But sometimes that doesn't always happen, and the family might have been in one situation earlier around the time of birth and might have had a lot of supports and didn't have anything. And then 6 months later might be in a very different position. So it's really important to have a program that can provide that kind of service so that it's not just restricted to, oh, well, you had your baby already, your child's too old for this. So this program, having that part of the mix is also equally important. And their primary concern is more about the educational needs of the child. But again, they will link families with any of the other kind of supports that are needed, and really help to prepare that child for kindergarten entry. So they do a lot of growth and development kind of work with the families, and ensure that the child is ready for kindergarten. And they go up to about age 5. So those are the 3 program models that have been operating for the last 25 plus years here in New Jersey. And as I mentioned earlier, we just added another evidence-based program model called Family Connects. Again, this one does utilize a registered nurse. It was signed into law in 2021, July of 2021. The intention to be a universal home visiting program, meaning this is going to be offered to any mom in the state of New Jersey that gives birth to a child, but it also is going to be offered to those that utilize a surrogacy to have the baby, that might be adopting a baby. So we want to make sure that the support is available to anyone welcoming a baby into their home, whether or not they were the ones who actually gave birth to the child. And that's important. I have a question. Kashika?
Yes, hi, quick question. Kashika from New Destiny. Now, the universal program, I know it's in like the beginning stages, and you probably mentioned this, but when does that start? Do you have an idea?
Well, I have a tiny idea. We do have a program pilot going on right now in Mercer County, serving a small number of families that are giving birth at a hospital in the Trenton area. And the goal is to start the rollout, which will probably be taking place early in 2023. There were a lot of steps to set up a program of this kind. And this is free to all, but all these programs are free, first of all, by the way, at no cost to the families. And setting this up and making it part of the maternity bundle. And for those who don't have insurance, it's also going to be available to them as well. So it's something that we want to make universal and make sure that there's resources to pay for it for everybody. So it's going to take a little while to set up the payment methods and to secure the hospitals and to make sure that these resources can be offered to all families. So it's going to take a little while, but from what I understand, the rollout is going to start in 2023, and it's probably going to take several years for it to eventually be available across the state. And it's my assumption, don't quote me on it, but I'm assuming they're going to be rolling it out in communities with the greatest need first before they roll it out in other communities. But the intention is that it is universal. and getting back, and that was a great question. So thank you for asking that. And getting back to this model, most families will probably only receive one visit. But again, it's going to be based on their needs. The nurse is going to assess the situation. They go in and make sure that they'll do a clinical assessment on the baby as well as the mom, and address any social service needs that they might have, connecting them with resources within their community based on what the family says that their needs are, and what they assess as what might possibly be their needs. If they need another visit, that could be scheduled up to 3 visits. And then there's follow-up done 6 months after the visit to make sure that those referrals, those connections that were suggested are actually being accessed. And a beautiful piece of this is also that, we're going to be identifying the needs of families and then figuring out whether or not those needs can be met within their community. And once we identify needs that are not able to be met in their community, we can really document that and make sure that those kinds of services will not then be made available for that family. So it's kind of going to be opening up a Pandora's box, so to speak, where we're going to hear a lot of things that families might need that certain communities may not have access to. But this year, the governor put into our budget having a community alignment specialist, what the title of it's going to be, placed in centralized intakes hubs, where they are going to be responsible for making sure that services that families identify are made available. And so again, this is going to be a process. It's unfortunately not going to happen overnight, but we're on a really great path. Next slide. So this is kind of continuing the conversation that I just had on how families can get linked to these services. So as I mentioned, we have in New Jersey, and we've had this since about 2008, it started to roll out, and it's now in all 21 counties, have what was called a centralized intake system. And now this past year, it has been renamed to be Connecting NJ. And the whole purpose of this Connecting NJ is to make sure that families have the resources that they need to support a healthy birth, healthy first few years of life, and making sure that children have everything that they need to thrive. So these programs are locally driven. So every county has a hub right now. And as I mentioned a little while ago, that a new staff member will be added to that hub to really be doing the assessments of what resources are here in our community, what resources are not here in our community, and what do we need to do to make sure that families can have access to these services. It's a single point of entry, easy access for information, eligibility, referral, and services. You can access it via their website. Right now, there's a website, connectingnj. Hannah, you could check on that for me if it's a .com, a .net, but we could put it into the chat box. But now families can self-refer, but we could also have referrals made by OBGYNs in their community and pediatricians in their community or social services programs in their community. And what the goal really is that we're trying to make sure that we're reaching families as early as possible, preferably during their pregnancy. They'll be doing risk assessments to see where families fall, to see what types of needs they might have. So what we're really trying to do is design a system that's, again, based on what the needs of the families are. Some families might need 1 visit, 2 or 3 visits. Some families might need intensive services for up to the first 5 years of life. But what's important is that we have a system in place, that we have different program models. It's not one size fits all. And these programs are really tailored to meet the needs of families, where families are, and they can change, because we all know that families' needs change during their first few years, especially if a new baby then is welcomed to the home after the first baby, what the different needs of each child may have, where a family situation might change over those years. And, we know things like pandemics can happen now. And during the pandemic, these programs have been so essential for families. They were the link to the outside world when the whole world shut down. And for a lot of families, they were the only outside voices that they were able to talk to and communicate with to ensure that their babies were on the right track, that they were on the right track. When they had a medical concern, families were afraid to bring their kids out, bring them to doctors and regular appointments. Children weren't seen by childcare during that time, or school during that time, preschool during that time. So they didn't know if there were problems or anything. So having somebody that came into their home virtually during that time, they were able to pivot and be able to provide these supports virtually and say, look, you need to get your baby here. I'll help you with this. We will make sure that you get the services that you need during this very difficult and challenging time. So they provided them resources from diapers, wipes, formula, all the way up to referrals to early intervention if needed, and healthcare appointments for the mom and the baby. So they were there making sure that babies and families were taken care of during this very difficult time. And having a program that has that one-on-one was so important. Next slide. Okay, so we're in a very difficult period right now because the program funding for this, the primary source of funding is federal dollars that come from a piece of legislation called the MCV, or abbreviated to the MCV, and that stands for the Maternal, Infant, and Early Childhood Home Visiting Services. It's a long title, and that legislation has been in place since 2010. The downside of that legislation is, although it's been here and it's our primary funding source and enables us to have a system like we have, it's been flat funded, meaning it has not increased since 2010. So can you imagine running your household on a budget that hasn't gotten any additional dollars in over 10 years? It is challenging. And, they've been struggling to try to stay in place and keep their staff. But as you can imagine, if you haven't had a raise in 10 years, you're not able to do that. So it's really been hurting our system that it hasn't had an increase since then. The program is now up for reauthorization, meaning that the government has to decide whether they're going to provide resources for it or not. And the resources technically expired September 30th of last week. However, it's been guaranteed to continue through a continuing resolution that the government voted on. And this is all federal. These are federal dollars, and our congressional delegation is the ones that we need to be targeting to make sure that this program remains in place. Now, again, this is funding that doesn't only go to New Jersey, so this is impacting families across the country. And what we're asking for is to have this piece of legislation reauthorized to double the amount of money by the end of the 5-year period, so that we're increasing resources so that programs can sustain what they're already currently doing. And fortunately, it does not have a provision that says that they have to utilize the increased monies to expand, because the first thing that they need to do is support and sustain what they have. And then once we do that and make sure that the workforce is compensated the way that they need to be compensated, that the programs have the resources that they need to continue to provide these services, and make sure that these services are of high quality, then we can start to talk about expansion and how we might be able to bring these services to a greater number of persons. So for right now, the programs are okay until the end of December, which means we have to do a lot of work now to get our congressional delegation to make sure that this is reauthorized and that there is no stoppage of services and funding in the interim. Because if programs find out that they were going to be defunded, what's going to happen? Staff is going to leave. They're going to say, well, there's no money for this. I'm going to start looking for another job. and then they leave. And when they leave, that means you have to find somebody else for that family to connect with. Families that have been working with the same home visitor since the birth of their child are like, I don't want a new person. I don't want to develop that relationship again. I want my old person. And generally, they would leave the program. So they're not going to get the full benefit of the program. And the programs end up suffering because of that. So we need to make sure that this program is reauthorized, that it's reauthorized at increased funding. And the other piece that we wanted to do is to be reauthorized to allow for the virtual home visits. While, of course, we prefer to be able to make in-person visits, we know that the pandemic has taught us that sometimes that might not be the best health-wise for the home visitor and the family that they're visiting. So virtual visits need to be kept in place. And a lot of time, the original legislation did not allow for virtual home visits, with the exception of the pandemic, and they want everybody to go back to home visiting. But what we also saw with allowing virtual home visits is that families attended more sessions as a result of it because it fit into their schedule better. So if we could have a blend of home visits and virtual visits when they can't make a home visit, that ensures that a family is continuing to receive intensive services throughout their time in the program. So what can you do about this? We would love for everybody to write their congressional representative and ask them to sign on. We already have 4 congresspersons from New Jersey that have signed on. So if you're from Congressman Pallone's district, Congressman Pascrell's district, Congresswoman Sherrill's district, or Congressman Smith's district, they got you covered. They've already signed on and are co-sponsors of this legislation and are all for it. And we have our Senator Menendez is the champion for home visiting. He has been since the beginning our primary champion. So we have a senator on board, and Senator Booker is also on board. He's a huge advocate for this work as well. But we're really targeting right now our congressional delegation. So if you're in any other districts than the first 4 that I mentioned, we need your help. Our website has a letter that you could send. You could tailor it if you'd like, but you could also just go on easily, type in, your name, and it'll put you into your congressional district, and you'll send that letter saying, I urge you to co-sponsor this incredible piece of legislation. The piece that I left out of this is that the legislation is now called the Jackie Walorski Maternal Child Home Visiting Program. Jackie Walorski was a congresswoman that was tragically killed this summer in a car accident. She was the champion from the Republican side that was working on the reauthorization along with her staff. All of them were killed in this car accident in August, which kind of stalled the movement of the legislation until they were able to move it forward. So in honor of her and her work, they renamed this piece of legislation to honor her. And it's incredibly moving. Ways and Means Committee met to talk about it, and there was some incredibly moving conversations about how valuable home visiting was. If anyone's interested, we could send a link so you could watch that too. And the other thing you could do is really like and share on our social media. We put up a lot of different things about the value of home visiting, what people can do, and just to keep awareness. So it matters when you like or share things because it gets to reach other people who may not know about this service and this fabulous programs that we offer. So I already talked a little bit about the workforce needs, what happens when, they aren't compensated as per what they deserve to be. And I've talked about Connecting NJ. That's a program, the new name for the centralized intake hubs across the state. And we're really going to be working to strengthen, expand them, add those staff persons to it, and make sure that, they are operating to make sure that services are available to families throughout their communities. So everybody has access.